connected to everything, and that's why I'm in everything. All eyes on me, all eyes on everything. That means everything. Eyes connected to everything.
I'm gonna wait till John throw the music. Oh, there it is.
Right on time, too.
Man, the music make it so much better. I ain't gonna even lie. Go, John. That was John's idea. I'm sorry. I'm looking at my Facebook. I didn't have a whole.
I thought that was Ivy's idea. What's that? I think it
was okay.
Oh, it was Ivy's idea. Well, we ain't got nobody in the room just yet. Make sure y'all go and I have to go and make sure my privacy is set to public.
Yes.
Facebook. Like
I'm gonna have to start reminding you of that. Cause you can't see it.
Yep, unless you change it.
It is set to public now, and I've also pinned it. Oh my God, I don't have anybody in the room. Nobody wants to talk about healthcare.
They may have to catch it on the
You know what? It's football season.
Oh.
That is true.
You know, football in the United States overrides everything. And that's why. I don't know. That just
Wait a minute. It got arrived though. That was cute. And I'm gonna go ahead and make this screen bigger. You know, there we go. Let's see. I don't know if she's gonna check this out, but I need to give a shout out to Victoria. She's a registered nurse at a local hospital. Thank you. She did me a solid tonight. I was expecting a new admit, but I was like, I gotta leave early. Can you send them after 7? She was like, I got you. Thank you. If y'all knew the paperwork involved in doing a new admit, y'all would understand. And I wanted to make sure I get here on time. And then ain't nobody here because everybody watching football. All right. Well, we're gonna go ahead and get
some love.
What's that mean?
You just love your own what's the name?
I love all of my own shit.
I loved it too. I just loved it.
I love all of my own shit. Why not? I'm gonna go ahead and get started. This is things that people don't want to talk about, brought to you by God Level. That will be me. I'm originally from St. Louis, Missouri, the home of the St. Paul. You can only get it right here in the Midwest. I am a nurse. I'm a mother. I'm an entrepreneur. I'm a friend. I'm a cousin. I'm an aunt. I'm a GG. I still look good for to be a GG. Yes, so yeah, do. I am everything good. John, you want to go ahead and represent yourself?
John Skywalker, the Sly Talker here, lyricist, spoken word artist, martial artist, personal trainer, lover of life, student of psychology, and I'm a father who has 5 hip-hop albums available on all major streaming platforms. If you're trying to tune in, plug in, chime in to some positive, conscious, feel-good hip-hop, that's your boy. That's the king. Salute.
Salute. Ivy, Tanner, you want to go ahead and represent yourself?
Hey, girl. Hey. It's your girl, Ivy Tanner here, hailing from Ohio originally, but I'm living in the wonderful PNW, the Pacific Northwest, out here close to Seattle. I'm a former Army broadcaster. I am the woman who talks about all of her different hamsters. With my ADHD, I'm an advocate for mental health, future art therapist, and I'm going to take the place of King Newborn tonight. I will be of service.
I know that's right. Wherever he's at. Aaron Patrick, you want to go ahead and represent?
So, yes, ma'am. My name is Aaron Patrick. I am from Columbia, Missouri, little bitty town between St. Louis and Kansas City. Not only that, I'm just coming off a 7-day fast. Congratulations to me, pharmacy
Hey,
technician for the past,
Man, she
yeah, for
getting
the past 20
skinny.
years.
Look at her
huh?
face. Look at her face.
Yeah, I feel my face has started glowing.
Like,
I got a glow to me.
I ain't gonna
So
even lie with
my
you.
Shoot.
When she
complexion
was
just
texting me every day, I was a little jelly. I was a
my
little
friend was
jelly.
hating on me a little bit. Yeah.
Just a little
Yeah.
bit, but I was still rooting for you though. Like, damn, go on, girl. Like she doing that. Getting up, walking every morning.
She's got
I'm
that
going,
Yeah.
glow.
Trying to
man.
got we got more years. I got more years behind me than I got ahead of me. So I'm trying to get this right. So I've been a pharmacy technician for 20 years, been in healthcare for how I'm about to sell my business. Probably 30 plus 30 plus years I've been in healthcare. Um and so I just want to say I'm ready to do this, and I want to say justice for Andre Rowland, and I will discuss that with y'all at a further date, which I will hear me say that more and more. It's a 30-year-old case,
Okay.
probably more than that, that has been unsolved in my hometown, Columbia, Missouri. Young black male, 14 years old. So we will
Wow.
talk about that more later on. But yes, justice for Andre Rowland.
Mhm.
Y'all ready to do this?
Yes, ma'am.
I'm ready. I'm froze, so I'm gonna wait. Okay, there I go. I was on froze. I'm gonna go ahead and kick this off. I got the idea from a guy at work about talking about healthcare and how we could just, make more topics out of just one word, healthcare. I've been in healthcare since I was 17. I started off as a CNA. If you don't know what that is, it is a certified nursing assistant. I did one-on-one care with patients. Back then, the workload was not as heavy as it is today. I did that for 7 years, and then after that, I became a nurse, LPN, in Ohio. I'm not going. It was not without its bumps and bruises. When you set a goal to do something, I actually failed my entrance exam, the science part. But I did not let that stop me. I went and got a book, read up on the science, went back, took it, passed it with flying colors. Hit another roadblock. I failed out of nursing school. Yes, because I had a big head. Because nursing runs in our family. And I feel like I've been a CNA for so long. I
Yeah.
had a big head. So I had to sit out for 3 months. And when it was time for me to go back, I broke down my computer and had my desk. And when I got back, people looked at me and they was like, "How could you come back?" I was like, "How could I not?"
Yeah.
Passed with flying colors after that, I must say, because I took it very, very serious. But my first job, I was doing so well. One of the supervisors was like, "How long you been a nurse?" I said, "Oh, I just graduated." She's like, "You could have fooled me." That's how good I was doing. I've always stayed with geriatrics. I like my old people in wheelchairs. I do get attached to some people. I'm not gonna lie. I do cry when someone leaves. I had this thing where when they are on their way out, I will go in and pray over them and tell them to ask God to forgive them for their sins, send them out. I recently stopped doing it. I just tell them, go ahead and go home.
Mm.
And I need to stop saying it because they leave it.
What to say they'll go.
When
to
it's
say that.
time. I'm sorry. What'd you say?
You may be sent to say that.
You know what? And you can see when you've been in this field long enough, you can recognize when a patient is coming up on their due date.
Mm.
You can literally recognize the signs and the symptoms of a patient coming up on their due date. To go back to me, I've been an MDS coordinator where I've sat down and did computer work on how the facility gets paid by what we do for the patient. Um, I've been a unit manager and ADON. And I want to say the best part about any title I've had was unit manager. I had my own vent unit, and then we added wounds. Didn't hold a lot of people, one room per person. I was able to go around and get to know of all my patients, one-on-one, family. So there's a good aspect of nursing when it is ran by a good owner. If your facility is owned by a corporation, you're gonna suffer, because it's more so about the business than it is about the patient. It's all about the dollar, the bottom dollar. You know, that one job that I did have last year, I loved it. But when they came and bought us out and said we were going to they took my unit, I was hurt. I was crushed. You know, I had developed a good relationship with the staff. We did huddle every morning. We kept the peace, no drama. Every other Friday, I would give one of the girls my card. She would buy the whole floor lunch. You know, I would come in at night. I really did love it. And then we was bought out by a company that was more concerned about the money. And when that happens, you know, everybody suffers, including the patient.
Which is definitely what leads us to. Oh, go ahead.
Yeah.
I'm sorry.
Well,
I didn't want to cut you off.
yeah, no, because you know I've been running all week, so I'm gonna go off of my experience on nursing, about nursing in the healthcare, system and what I've seen. But I've been so busy with everything that's been happening. Even when we were doing our powwow and I had y'all to the side, there was a code. I had to hang up and go. It's like, I'm sorry, hey, duty calls, you gotta go, but go ahead.
Yeah, it's about to be the holidays. So that's definitely what I found in healthcare is during the holiday time is when you start experiencing more losses is during those winter months for some reason. I'm not sure. But back to what you were saying about being bought out, that's what we have been discussing, and I think we're going to discuss today about hospital systems turning into a corporation and being more based off of money versus care. So they want quantity versus quality.
Right.
And the bedside manner has changed because of the corporate rules. So when you start implementing corporate rules as into any company that has been taken over by a corporation, they start having set standards that are based off of research that a computer has generated. So then they say this is what we think is supposed to happen. This is where it's supposed to be. They don't figure in too many of the anomalies. They just figure in basic average stuff, and then that's what you start basing your healthcare off of.
I can believe it.
And so I think what we found out was there's hospital systems or hospital chains, and they own several different hospitals. So that's where the corporations come in. And then you also have nursing home systems that own 30, 40, 200, 300 nursing homes.
Oh, wow.
Yeah. I'm sorry. Can I just interject one second?
Go ahead.
The facility that I used to work at last year, we was the 176th facility that they had acquired.
Wow.
Yeah. Big company. And what's crazy, they're owned by two men, but all the people that are running it are all women.
Oh.
Yeah. Go ahead.
Yeah, I was gonna say by them doing that, and because it's a corporate thing, that means across the board, all 176 facilities will be run the same way, no matter what the demographic is, no matter what area it's in. Because some places, if you go in some areas, you may have younger patients that require different things, and when you start trying to apply rules for people 65 and older, for people 30 to 55, that starts to cause problems and starts to interrupt the patient care and stuff like that. So we are finding that they're getting younger and younger too as they're going to nursing homes.
Yes.
Hmm.
Yes. I can't say her name. We currently have a 26-year-old in our building right now.
What?
Yeah.
Wow.
Yeah, that's the youngest that we've seen.
And normally
Yeah.
that's from drugs and HIV.
Mhm. That part.
And I hate to just throw that out there, but usually you find the young strokes, young heart attacks, and things like that from drug overdose. And then, of course, whatever complications there are with HIV from not taking care of themselves. Not so much the HIV patients, because it is something that you can live with, and they do have medications that are working. But early 2000s and then the 2000 and teens, definitely it was a lot of HIV patients in nursing homes, young
Oh
HIV
yeah.
patients.
Wow.
Yeah. You
That is
still
sad.
see them in their late 40s coming through. HIV positive in their late 40s.
Hmm.
Yeah. Yeah. The nursing homes is no longer old people in wheelchairs. Maybe in
Uh,
some areas, but a lot towards the cities. I don't know why he keeps getting sent out. Can you help him?
And a
He's
lot of
taking
that
steps.
has to do with funding or costs, because you'll find that some nursing homes will allow homeless people to come into their facilities, and they're young because they have the certain diagnosis that they get to come, and because they're getting a check every month, they're qualified for a Medicare or a Medicaid bed.
Oh
So
yeah.
you'll find people that probably shouldn't even be in the nursing homes with other elderly people that cannot defend themselves or really can't take care of themselves, roaming around nursing homes, because like I said, they want quantity over quality.
Wow. So
Yeah.
they're not even thinking about like the total demographics of so okay.
No.
So
It's
Mm-mm.
about money.
so my hamster started rolling. Y'all know I don't know a whole bunch about the healthcare system, because that's not what I didn't come up in that for 20 years. So I guess the question that first comes to mind is, so when you get these different homes and you've got these young people who are coming into these you've got these younger people who are coming into these nursing homes, who, like you said, really shouldn't be there because they're with an older demographic.
Right.
Like is that like a county? Is that like the county healthcare system? And is that like the um like, I know we talked about the four different types of healthcare systems, right? And I know John will probably end up getting into that, but what makes what that it's just not computing for me. I'm like,
So
what
with the
makes
Money.
them
nursing
say,
homes,
Money.
yeah,
what they do, and this is on the lower end of the nursing homes that I have
Thank you.
seen. Higher
okay,
end, not so much, but on the lower end of the nursing homes, they start basically scouting for patients.
Yeah. I've
So
seen that.
every nursing
wow,
home has like a public relation person that goes out there, and I'm not sure what they call them. They may call them public advocate, patient advocate. They some type of advocate that goes out into the community,
To different hospitals.
right, to bring in
Hmm.
patients.
Yeah.
And the lower end ones will bring in the patients that usually have
Nobody else
some type of
wants.
mental disability, and because they get a check every month and they qualify for Medicaid, they can finagle and get them in. So by them getting them in, it causes a hazard for because we talking about assault, sexual assault, um theft. We're talking about so many things because these people are still able to walk around and do whatever they want to do as if they were on the streets. So, and then you got to think about the quality of patient care or nurses and CNAs that they have there too. Those are usually people that probably can't get a job at other places or don't want to get a job at other places. So it becomes a very unsafe environment for people. And like I said, once the nursing home starts to go down, it's all about quantity and not quality at all.
There it is.
So I guess I'm going to ask the question, kind of ties into the question that John just brought up right here. What part of the 4 healthcare systems does that lower end home fall into? Because I mean, you know what I'm saying? Like we talked about the 4. I don't know, John, you want to talk about the 4 types of?
It would probably be uninsured, and then the what's the one that is it the
it's
beverage
probably
model,
privately
the
owned.
government.
Yeah, that one. Yeah, so that one right there in that scenario, that sounds like it's more like a privately owned nursing home, right? So if you think about who owns that, you know, who's presiding over that whole schematic right there. And you said, and then we're categorizing, right? So we're saying on the upper end, so this is socioeconomic status now. So we're saying on the upper end, that doesn't happen. That kind of mixing doesn't happen in terms of the demographics. But this is more of a poverty issue, right? So we're still providing a service. The nursing home is still being provided, but to a particular demographic, which is the impoverished demographic. So yeah, that's probably going to mix up. And that's a market, right? I want to highlight something though before we start going into this, right? The focus right here is on the fact that the American healthcare system is primarily for profit. It's primarily. So everything that we're discussing here has to be through the lens of capitalism, right? And so we're just trying to dissect and analyze and evaluate, how did it become this way? And we understand that, you know, we are in a capitalistic system, but this is also somewhat of a hybrid system as well. It's a different flavor. At what point does human rights come into play, right? That's always the question in all of our affairs. So when you're talking about healthcare, how is that not a human right? Because the reason why it's like this way, one of the primary reasons why our healthcare system is the way it is ideological differences, okay? There are large ideological differences here. So at that level, how can that happen, right? How can that happen to where some enterprise owns this institution that's tied into healthcare, which is a human right, and yet you can create these unsafe environments and there's no intervention? That's capitalism for you. But
so I'm going to tell you. Right. I'll explain one of the reasons why people can fall through the cracks is because they have this thing that came about probably within the last 25, 30 years called medical coding. So if you put those numbers in correctly and finagle those numbers just the right way, you will get paid because everything is based off a code. So some of these diagnoses can be coded, and people know how to do that. You got people in the federal prison right now that work for doctor's office that have coded $1 million surgeries for people that didn't even require those surgeries. Yes.
MDS.
That's the real deal. So when you start coding and you start to learn what the insurance is, because by me working in pharmacy, we also work with insurance. So when you find out what the insurance will accept or won't accept, some people start using those codes because they know it's a for sure payment.
Yeah. Nobody is allowed to be coded independent, because if they was, they wouldn't be there. If I have to do this to your hand just one time, that is considered an assist. And if I have to move it over, that is considered maximum assist. The more they do for you, or the more you do for a patient, the more money you can make off of just that one patient.
Okay, so I just wanted somebody named Ebony Brown says, like, seems like some of these problems are caused, like they were talking about in the nursing home, are branched off for them no longer being adequate mental health care facilities.
It
Um,
is
just
exactly
wanted to,
correct.
so so it's just blowing my mind. It's blowing my mind that you're saying like it's the coding, like the
Mhm.
medical coding has something to do with it. I mean, and I understand that healthcare facilities are for profit, but I'm like, who's regulating that? I
Right.
feel like there's got to
And
be somebody
so
regulating that.
that's what some of these organizations were supposed to be for, right?
Mhm.
The professional organizations are supposed to help with the code of conduct, the code of ethics, right? That's why there's an AMA, right? But then federal regulation, there's a cutoff, so we do have state regulations, we do have federal regulations, and how these subsystems are supposed to be ran, right? But then there's the question of oversight, right? There's the question of implementation, but more so the oversight. Unless you report what's going on, because I mean, who's watching at all times? Who's watching at all times? Like, you could hire a third-party entity to create these regulations, or even to create them and oversee them, right? But they aren't in these nursing homes, they aren't in the hospitals, they aren't in these facilities, right? These are the people. So there's also a question of, is anybody reporting this stuff? Does anyone have the courage to report this stuff? What do we believe in our reporting practices? Do we think that we would get justice?
Mainly, no, they don't, unless you get a disgruntled employee. But for the most part, people will, and I've worked in healthcare for, like I said, 30 plus years, so I've seen it. And on the pharmacy, and I even worked for a pharmacy where the feds kicked in. This was
Yeah.
a pharmacy, and they were coding and billing incorrectly.
Yeah.
So it becomes a federal crime. They actually did kick in, start ceasing records and things like that. So yeah, I was looking at Dion, and they regulate with random audits on everything, but you got to think about, if you only got 25 auditors and you got 1,700 nursing facilities or care facilities in your city, how thorough of an audit do you think that's really going to be?
Yeah.
And I don't know what the ratio is, but I just know that there's way more facilities than there are auditors. Because
Yeah.
when I worked in nursing homes, and I'm sure God level can tell you this, you see those people again. It's not like you start to know them, like, so and so coming, she cool, or nah, don't fool with that one. Y'all know he don't play. You start to recognize these people because you see them over and over.
Oh yeah.
Let's take a step back so that because we're covering a lot, but we haven't really set the soil,
Dug
right?
into
So
right.
This is why we're going to be talking about this all month, because it is a lot. And to go back to what she was saying, when the feds come in and they start to find things that are wrong, they will shut you down.
Completely.
There is no amount of money that you can pay to get them out of your back pocket. They shutting your building down, and I have seen it after not working there. The guy was overcharging Medicaid by the millions,
Wow.
and they shut that building down and moved everyone that was living there to a different nursing facility. And this was up in Ohio. So yeah,
Wow.
when the feds walk through your building, it's a problem. They're worse than state, honey. You see the feds,
Oh
you
yeah,
better be, yeah.
that
And
means
you
it's a crime being
it's
committed.
there you go. And they will also come if you call yourself getting a perfect score, because state comes in once a year to do survey. You get a perfect survey, the feds is coming right in behind. Nah, you must have missed something. Nobody gets a perfect score. Nobody. So yeah.
So will you guys explain the healthcare systems? Because I mean, it's like I said, I never knew about any of this stuff until this week, right?
Really?
Like I've known that there are different types, but I never knew that they had names. And I mean, like the fact that you're even saying that the medical coding is what is contributing to like some, some say more
Things
say
that's
That
more
going
controls
on.
almost
unsavory.
every. Yeah, it
That
Yeah.
controls
controls
almost
yeah,
everything because that's how every medical entity
facility.
gets paid.
Yeah, they
Once
get paid
they
per
started
person.
coding those, yeah, once they started coding using these codes, and it could be something like a broken arm with gangrene, then you start adding codes as you go down the line.
Yeah.
I've done some coding, so that's how I know how it goes. So you could do you could have a main category, then a subcategory, and then it goes on down. Then
Yes.
not only do you code the diagnosis, but you code the procedure,
Mm-hmm.
and then you code the
Yeah.
medication. So
Yes.
everything is work based off a number now,
Mm-hmm.
not based off the patient anymore.
No.
Wow. Wow.
And
Wow.
they get paid per day per patient.
Okay, so who developed
And,
like
and if you're skilled, that's a lot more
Right,
money.
you get more
who
money.
developed the medical coding system, and what healthcare
Uh,
system does that belong to?
That's a
the
good question.
entire system.
The
Now
entire
that's a part of, so hold on, I'll tell you when it began, because it began early 2000s where everybody started using it. And I forget what
the change.
administration started requiring that.
Okay.
Yeah, the
All right.
change.
So I remember earlier John talked about, well, he didn't talk about it here, but we talked about it in the powwow, the four models, right? The beverage model, the Bismarck model, the national health insurance model, and then the uninsured model. Like all of those different models of healthcare, right? And then like the different types that, like where they came from. Like I think the beverage model came from Germany.
No,
Can you talk a
the
little bit more?
Bismarck model came from Germany. The
Okay.
beverage model came from the UK, and they still implement that today.
Okay. And can you talk about like the one that you were talking about, like the lower healthcare system? Is that a part of the national healthcare model, or is it part of the beverage
Are
model?
you
I'm
talking
not.
about the uninsured model?
No, the uninsured model, that's just where you pay out of
Yeah,
pocket. That's where everybody
yeah.
pays out of pocket. And then the national health insurance model, that's like what Obamacare tried to do, like to make sure that everybody had, that's like universal health care,
Yeah,
correct?
it attempted to achieve that. Yes. It was an
Okay.
attempt. Right.
Yes.
But I mean, but America already has two. So
Okay.
first off, to be clear, America uses all of the systems that we're
Okay.
talking about here. We use all of the models, right? So everybody, like there are some people who are uninsured, right? There's some people that are on Medicaid or Medicare. That's national insurance, right? Everyone
Okay.
has access to that, but you still have to qualify for it. So we just have
Oh yeah.
qualification, but it's actually accessible to all Americans, right?
Mm-hmm.
So that's why I say we technically have all four of them. But then you could also get private, right? You can get private
Through your
Yeah.
insure through your job.
right?
Yeah.
So
Yeah.
not only does it have to be just private insurance, like the financial aspect, like where you pay an entity and then they help to take care of you, but you can also get privately owned, like you can get serviced by privately owned institutions, right? So that's the Bismarck model. That's Japan. We do that as well. France, South Korea. And then there's the beverage model, right? And that's the UK model. That's basically state-funded, state-provided, government-provided healthcare, right? That's the VA, the Indian Health. What is it? The Indian Health Service.
Yes.
Yeah,
Okay.
Native
tax
the
funded.
Native Americans.
Yeah.
Yeah. Okay, Indian Health Service, that's what you call it. So Aaron, you're saying that all models, they all now have medical coding as a part of the system.
As of 1999.
Okay.
Not only us, but it's worldwide.
Okay.
So basically all the codes are on the same, all the codes are it's universal. So basically they wanted one language, one healthcare, one language.
Yeah.
So it's universal across the board. So if London, France, everyone else, they will be billing the same way. But it's basically to keep track of everything, because all the way down to a BandAid is coded. Remember when you could go, I'm guilty. Remember when you could go to the hospital and go in them drawers and start messing with them people's stuff and then accidentally go walk home with you? You can't do that no more because
Accidentally walk
everything
home
is
with you.
everything is coded now, so it all has to be scanned out under a certain code. But I know y'all remember when everything was like basically in the drawers, in the house, in the nursing rooms or the patient's rooms when you go in there
Yeah.
to the emergency room. I know y'all
Mhm.
remember this. Don't act like
Yeah.
I'm the only one that walked out
Like
with.
them gloves, like them gloves. You would take some gloves.
Yeah, specimen cups, just silly stuff, that
Man,
you may not even supposed to be messing with, but you don't see that anymore. Them drawers is empty as hell. Go in your doctor's
Yes,
office
they
next time you go in and open up
wow.
them drawers and see what you see in there. Nothing, because everything is coded now. Everything
Okay.
is coded. Gauze, tape, everything is coded.
Yep. Whatever they got to use, they gonna get
So
paid
that
Are
for
goes
you,
to
everything.
why they passed the law so your bill would be, so everything that you get billed for is now
God.
available to the patient. So now you start seeing how much Band-Aids cost. You start seeing how much they charge you for the specimen cup. The cup that you pee in, that gets scanned out. All of that stuff
wow.
is coded.
I mean, but so why? I mean, why do they do that? I mean, does that add to a good? Does that add to a good healthcare system? Does it make it better? I mean, does it
That's
make
to
it not?
a good
It's a for
business system.
profit.
It's a
It's for
business.
profit.
Got it.
Business.
Got it.
Business.
Wow. So they are
It
recouping
is.
them BandAid prices.
So in this
Yes.
country, right? In this country, one of the core principles of manufacturing and capitalism, right, is I want to pay out the least amount of money, have the smallest expense in order to increase my profit margin. So yeah, I'm selling you this. It don't matter if it's a Band-Aid, right? If I can raise the price on this and get it out of you, and it's for cheap at its, what raw value, right? It took like, I don't know, maybe $3 to make this. All right, it should be $3 because that's how much it costs to make it. But you're saying, okay, you know what? We need to make a profit off of this, and we know there's a demand for it. We can charge, I don't know, 50% more. We can double the price, make a profit, even though, like, we don't want to break even. Why would we want to do that?
Right.
No.
That's the mentality. That's the game. It's a game for them.
Yeah.
It's not about it. Like, yeah, they're dependent on us, but there's a parasitic nature about this. It's parasitic. These people are sick. We're sick. We need healing, and you're gonna add
kick you while you're down.
Yeah, you're gonna kick up the price. You're gonna kick up the price just so you can make a profit off my sickness. It ain't about the goods. It's not about the service. It's about the price that's associated with it. So of course, you start developing metrics around that. And that's, again, this is the game, capitalism.
And that's the game.
We do it in other industries. We do it with clothes. It took maybe $10 to make those pants, and you're gonna charge $60 for them, or 100, or white t-shirt, $5. You're gonna charge 100.
I got a good one. Jordans.
Oh yeah.
Made in China.
How much does it
Definitely.
cost to make a pair of Jordans, and then they hike up the price? And
Right.
yeah,
And they understand that, again, there's a psychology to this. People are going to pay the price, and if they're not, well, there's going to be a penalty for that.
Then you're just gonna be sick.
yeah.
Think about when you go get your car fixed and they charge you $75 for oil, and you like, nah, I can go to Walmart and get that oil for $30. Okay, well, if you don't buy our oil, you won't get no oil, because we're gonna be the ones that put it in.
That's facts.
Yeah.
And so basically, if you need this Band-Aid and this Band-Aid's $25, if you want us to put it on you, right? if we gonna put it on you, I'll even go to this, and this is facts. And King Newborn, if you want to say your spiel about entertainment purposes only, but this is true. So I worked at Walgreens for about 5 years. So
Mhm.
anything that comes out of Walgreens, say for instance, you need some vitamin C, a 30-day supply of vitamin C. They don't even sell vitamin C over the counter in 30 tablets. Really, you probably get 100 tablets, 120 tablets for
Yep.
$6.99. If we put a label on that, it's $11.99 plus whatever that medication cost. So automatically, before it even leaves the pharmacy, you're gonna pay $11.99. That's the base pay. Well, not it's $12.99 now, but that's the base pay, $12.99. So if you're a cash paying customer, you may pay $20 for vitamin C that you could have just walked over there on the shelf. Now the doctor done wrote this prescription for you. You took it there. You thinking that you got to get it, and I usually would tell them, "Look, you can get that for $6.99. Go over there and grab it right there." But our price would be about $20 just for 30 tablets of vitamin C that you could get right over the counter because of that base pay.
That's crazy.
'Cause
Why
it's,
is healthcare in? Okay, go ahead. I'm sorry.
I was gonna say because we don't have a choice. I mean, it's a necessity. It's not like we have any. We do have alternative options, but how comfortable are we with those because we've been programmed to utilize our healthcare system?
Mm.
All right. So to this question also, I think it's paramount to note that the healthcare system is very complicated, and that largely a lot of the costs, because again, we're in capitalism. These are services, these are goods. It's market driven, okay? So if we understand how markets work, we're still dealing with the market here, and it's a capitalistic market. It might have some socialist hints there, but we're still talking about the overall ideology of the country. It's a very competitive place here, right? Because it's market driven here, that also means less government intervention, unfortunately, right? So over in, let's say, the UK, the government is heavily involved. There's a lot of policies. The policies and your legislation, that kind of represents, well, largely for the most part, that represents the consciousness of the country. It's basically like saying, hey, this is what we think of its residents, of its citizens. So what is really saying when your government doesn't intervene and the market is this predatory, it's really saying that the government don't really care about its citizens like that. Because otherwise you'll be like, man, no, I can't let you do that to my folks, man.
Preach.
Let's put a bar here and a brick here and a wall
Preach.
here and protect them there and an orb here and a spatial.
Preach.
Your government ain't intervening. And like, we ain't touching that. I mean, y'all got that.
Yeah.
We'll do this little bit over here, though.
With the intervention. Yeah. Like you were saying, they trick us with the intervention.
Right. And
they
so you also got
every go ahead. I was gonna say every time they pass a law, like with the Obamacare, it was all so great, and they said everybody's gonna have insurance, and so on and so forth. But the only people that it helped was really the hospitals, because a lot of people that didn't have insurance used the emergency room for their insurance and just didn't pay the bills or whatever, and left it at that. But when they gave everybody insurance and covered everybody, that means that, do y'all remember when deductibles were not, you didn't even have a deductible? All you paid was a copay, $10, $20. As soon as Obamacare came in, you had these $500 deductibles, $1,000 deductibles. Then your copays went up to $40, $50. A specialist copay, $60, $100. Stuff started going up, and y'all might, because y'all are military, your copays may not be that high, but private insurance, there are deductibles, and that came when Obamacare came. But they throw us a bone like, hey, we're gonna fix it and we're gonna give health care to everybody, but y'all gonna have to pay for it, because those that don't pay for their health care because they don't have a job or because they don't make enough money, those high deductibles is what covers everybody else's health care. We didn't have those deductibles then. Go ahead, Don.
So I was going to list a few other variables that contribute to this, right? So one that's often overlooked is defense medicine, right? And so that refers to the medical malpractice lawsuits that are out there, right? So just think about what happens when, all right, a doctor or a few doctors got sued for misdiagnosing someone, right? And that litigation leads to them, paying out, right? They're still businesses now. This is still capitalism. That company, or I'm sorry, that office goes out of business. Those offices go out of business because of that malpractice suit, right? They going for like the jugular, right? So now you have other doctors that look at that and say, man, you see what they doing out here in these streets, right? We need to cover our ass by administering all these extra tests, which cost more money to the consumer, right? So let's just say the cost of an MRI might be $580 here in the US, whereas in, I don't know, New Zealand, it might be $120, right? But the difference has nothing to do with the fact, it has nothing to do with there's no global regulation here. This is country by country. Over here, it's that high because they're trying to accommodate for the risk. And then if they're, successful, like, oh, okay, we performed the surgery on you, it didn't go bad. All right, well, we were going to try to cover some of that cost anyways, right? This is also about risk. We haven't even talked about the pharmaceutical industry.
Oh my God, I can't. Big pharma.
Yeah, that's gonna be a whole.
Lord
Yeah,
have mercy.
have to be a
That's
whole.
that's a
show
whole
on
that's a whole nother show.
on
That's
its
a whole
own.
nother show.
Man,
Okay.
That is a whole nother show. Right
That'll
now
have
we're doing
to be an
good with
entire
just
show on its own because
with
that's
the basics. We can do big pharma next week, but this is just the basics. Well, actually, next week
Lord.
we have an administrator who's coming on by the name of Miss Jamaica. So she'll be with us next week, and she runs a nursing home. That is probably one of the only positions in a nursing facility that I haven't had is administrator. Yeah.
Now, here's another element to this, right? Price transparency. We kind of touched on it in the beginning, right? Now, if you knew you were, I don't know, let's say you were about to give birth in like 3 months. There's 17 hospitals in the area, right? And you're shopping for a hospital based off of the cost. We're still talking about the market here. The problem with it now is that there's not enough transparency. Oh, go ahead.
Does this person have health care insurance? Because if they do, they tell you certain hospitals that where whoever your doctor is and where they're practicing, that's where you in that network. That's where you.
I mean, that's one scenario, right?
Okay.
But I'm just pointing out that how price transparency would really influence a lot of these prices that's going on right now. So because people don't know, we don't know when we go to a hospital, like, all right, hey, I'm gonna have my baby here. We don't know that per se. We don't know what it's gonna cost, right? But if you put just a little bit of that responsibility on the consumer is gonna choose what's best out of the market. If I can get it for cheap on the hospital that's on 5th Street, and I let all my folks know, like, hey, start giving birth over there because, they do it for $500 cheaper. You don't think the other hospitals would be like, oh, dang, we losing business. Like, we ain't giving no births over here. There's no price transparency here. If you could go, like, again, it's just like, when you buy something off of Amazon or you buy it off of any website, right? And they say, you say, hey, I want a refund. And they ask you, hey, why do you want a refund? And you say, I found it cheaper. You're signaling something to that company, to that organization that, oh, shoot, wait, we just lost some business. Nigga, we need to go figure out what's going on with the competition doing. Oh, they doing baby deliveries for $500 less. We need to do it for $600 less. That can't happen. In the healthcare system, that cannot happen.
There's no competition.
And it can't happen because of insurance. It's because of insurance. Insurance regulates everything in medicine. Everything. So
everything.
Whatever the insurance, and if you are a cash paying patient, your prices are based off what the insurance is going to pay. They
Yeah.
don't give you much of a discount. They'll tell you, okay, we're going to give you a discount and so on and so forth. And here's the kicker with insurance. Insurance basically tells the hospital what they're going to pay them. So when they send that claim in and they send it in for $25,000 and the insurance company says, no, we think it's worth $19,500, you get $19,500. So you don't, it's like the insurance are basically, they run everything.
Yes.
What?
And so, right. So we got to figure, and with America, I mean, what would be ideal is America needs to figure out why are we paying for insurance? Why do we have a middleman to negotiate our prices that we can negotiate for ourselves? You think I couldn't tell the doctor or the hospital, nah, I got 19,500. You know, you think I couldn't do that on my own?
Right.
So we pay them to negotiate prices on how much they're going to pay the hospitals or the doctor's office for what?
What?
Yeah.
You're good. You have VA. You're with
Yeah.
VA.
Yeah,
Am I
so
correct?
yeah, by you guys
Oh,
being veterans, yeah, the private
VA
insurance, y'all don't have to
contracts
deal with much.
are a hot commodity in nursing homes.
Listen, but
Y'all are to be treated like gold when you walk through the door.
Yeah, that's guaranteed
Really.
good money.
Guaranteed good money for
not
VA.
all gold is necessarily gold, bro. Because you know that.
I'm telling you how they do it in nursing facilities.
Oh, in nursing.
If they lose their VA contract with the VA, it's a problem.
Oh yeah.
Security.
It is a problem.
Yeah, that's security.
Yeah, I can see that security. I can see that.
Man, it is a problem. But yeah, y'all are like diamonds up in there.
Yeah, and
Wow.
then your TRICARE insurance and things like that, that's that they pay on a different level. That's why they like the federal insurance. But our private insurance, you know, it's a one big scam, and somebody getting paid a whole lot of money
A whole lot of money.
just to
And
dictate.
just think
Because insurance, go ahead.
just when you don't use it. If I'm paying $1,200 a month for just me and my daughter, $600 a paycheck for just me and my daughter, they're expensive. The first $1,000 may be free, and then after that, I will have to pay $500. And after I pay the $500, then they'll kick in. It's going to be a copay wherever I go. I'm only allowed one visit for one workup. I'm so serious.
Wait a minute.
You all have VA. I need somebody out there with Medicare, with medical insurance. My sister has 4 kids, and
oh shoot, I bet she's paying a lot.
Man.
Yeah.
Okay, because I'm like, when you said okay, so
and they'll try to tell you, oh, we're going to take this pre-tax.
Right.
pre-tax?
That'd be the trick.
Yeah.
Oh, this is pre-tax.
Right. So they make you think that you saving the money because they take it out of your gross. They take it out of your gross.
Pre-tax.
Wait a minute. So you said
we in the wrong business. The insurance companies they getting paid.
You said the TRICARE and VA, they pay on a different scale. So basically, like that $25,000 procedure that you talked about, right? And you said the insurance company be like, nah, we're gonna give you $19,500, right? Yep. So is TRICARE sliding, or is it just because of the fact that they're federal? They're just like, okay, well, we know we're going to get paid. I mean, like, I'm like, what is it? Because that, like, you just blew my mind.
It's going to be a definite payment from federal. Yeah, it's going to be a definite payment from federal. And then I think they pay a little bit higher. They don't do as much negotiating. Because they they just like, here you go. And then if you think about it, the VA, y'all can go to the VA emergency room as many times as you want to and not pay nothing. If I go to the VA, if I go to the emergency room, they want $250.
Just to say hi.
That's true.
And I got insurance. But they still want $250. They still come in that room and say, if the copay is $250, How would you like to pay? I don't like to pay it
And
out.
in a sense, in a sense, yeah, they are identifying a certain kind of privilege, right? Because if the VA decides to outsource some of their care to the general market, and that's guaranteed pay, the VA is vested to know, like, hey, so because they send us emails, right? They say, hey, how was your care at
Yep.
so and so dentist, right?
Yep.
They ask us why,
Yes.
because they're like, hey, we need to know if they didn't
Right.
treat you here,
Exactly.
yank
If
that
you on
contract,
bullshit,
right?
yeah.
Yeah.
So
Yeah.
of course
They
they're
will.
gonna give us the royal treatment, right?
They
Because
Because that
will.
means that
they don't want to mess
not
up that
only do they
contract.
yeah, so not, and again, we're talking now
Yeah.
coding gets into the mix, right?
There
You
you
can
go.
add more to us on the coding side and say, yeah, we treated them with the utmost respect. By the way, here's the bill.
There you go.
Right.
So
Exactly.
that just kills me. I'm like, if that's a national, okay, so we're VA is national, no, not national insurance. What model is that? Because I'm thinking, I'm like,
Federal.
if not,
Beverage.
if that's the
State.
case,
Oh, it's
then
a
why-
state funded.
no, that's
State.
federal.
State or federal. It's basically government. We're just
Government
talking about
funded.
Yes.
Okay, because I'm just thinking, I'm like, then wouldn't universal health care just be? Wouldn't that be better? I mean, if that's the case, you know what I'm saying? I mean, where all healthcare is federally funded, and why is it that that blows my mind.
No. So private insurance is through your job. That's the
Yeah.
insurance that we. So how that works is your employer pays a certain percentage, and then the employee pays a certain percentage.
Yep.
Of the insurance. The more employees that you have at the company, the lower your insurance is, because that means it's shared by more people.
Mm-hmm.
So like when I worked for Express Scripts, ours was based off of how much we got paid per month, because it was based off of they had so many employees, so they could play that game. But then when I went to work for a smaller company, there's not a whole bunch of people putting in the pot, so we got hit with the most money. Like it cost us more for there. Now with the VA, I think ours is based off of pay as well. The CEO or the director pays more versus the people that are lower on the totem pole. I think we got a question here, or a statement from Tasha.
Oh, I didn't see that.
It says, my dad is on Medicare. His doctor recently changed his RA rheumatoid arthritis meds and put him on a drip that was $19,000. I believe it. He received a bill for $13,000. He is on disability. I had to go to the doctor and ask him why the heck they put him on this.
Wow.
Was that a outpatient? Was that an outpatient medication? Because if it was, I can give you some information on. So they have, and I guess we're gonna do pharmaceuticals another time, but they also have manufacturer discounts, or where you get medication free from the manufacturer. So what they're doing, what the manufacturer will do is, you fill out this application, the patient assistance program. You let me know what the name of that medication is, and I'll find out who the manufacturer is and send you a link. So you fill out this application for the medication. You tell them how much money you make, so on and so forth. By him being on disability, he's automatically going to qualify. They will give the medication free. Now, we all know it's not free. It's a big tax write-off, and so on and so forth. They do this with almost every medication, but it's all brand name medications. So
wait a second. Repeat that again.
Yeah.
Did I just hear you say? Say all of that again. Did you just say that there are some medications that you can get from free if you get them straight from the corporation?
Yes, ma'am. That's exactly what I said. So I mentioned Express Scripts. So this will tell you how plugged everybody is with the medical system. I work for Express Scripts. They had the contracts for every major manufacturer that did these programs, and I work for Pfizer, one of the Pfizer programs, and AstraZeneca. So people would call in and get these applications because these brand name medications that just came out, they couldn't afford them.
Okay.
And they're all brand name medications.
And you
and
just
you go ahead.
no. So you said you just talk to the manufacturer, and the
Mhm.
manufacturer will they will give you a medication for it. Hold on, let's see. Oh, you have to meet the financial
Meet the
requirements.
financial requirements.
Okay.
But the I think it's 3 times. I have to look at it's like 3 times the poverty level or something like that. It's pretty high now. It used to be the financial requirements were really low, but now they have upped them.
But I'm thinking if you're on disability, and Tasha, and let me see if what type of disability are we speaking of? I mean, because are you talking about Social Security? Are you talking about I mean, is your dad a veteran? Well, if he was a veteran, he probably would be getting that drip for free, right? I would think.
Mm-hmm.
And I'm thinking, I'm like,
He
what type of
If he was
disability?
getting
Because
it through the VA, uh-huh.
yeah, because I'm like, if you're on
But her
disability,
dad
man,
is on, but he's on Medicare, so that means he's an
Oh,
elder.
That is on Medicare.
okay, all right.
Yep. Rheumatoid arthritis.
And you can still get it on Medicare. You just have to certify that you are unable to pay the amount, because Medicare has a donut hole, and we'll go through all that where they don't pay
Okay.
nothing. we can go through all that, but yeah, there's a donut hole. It's really not, like I said,
Oh,
they put all this stuff out here and make it like that they're helping us, and they pass all these bills and they say this is what we're doing for our people, and we're gonna make sure that everybody has health care and so on and so forth. But guess what? You still ain't gonna be able to fucking afford it. Excuse my
that.
language, regardless
Say
of what
that.
they do for you.
Preach.
Wow, that is crazy.
Preach. Nope. It's gonna give you a pill, smack you in the ass, and tell you to keep going.
Listen, I know
Right.
the adage at the VA was they don't necessarily wait to cure you. They wait for you to die off. So that way they can, you know what I'm saying? So that way they don't have to worry about paying for all of those different, well, that's what the thing used to be through the veterans. That's before they started doing a lot of VA reform, because now they actually do reform. So in some places, the VA can actually be useful. But that's now. But I'm just still just like, that blows my mind. Y'all have to excuse my ignorance to all of this, for real, because you're dealing with
It's a
somebody
different
who's,
language.
man, completely different. Like, wow, I'm floored.
And it's very big. It's massive.
It's sad.
So many.
It says, why
It's
doesn't
sad.
the U.S. have universal health care? Because poor people don't have lobbyists. Insurance company have lobbyists. We don't have anything, and we don't have enough unity to come together and put our money. You know, if you put $2,000-$3,000 with somebody else, everybody worried about what somebody gonna do with your $2,000 or $3,000. So we won't even go together to try to get a lobbyist to lobby against these big insurance companies, because that's why we don't have universal health care, because it's a law, and they have these lobbyists that can pass these laws to maintain these insurances.
Yep.
That's crazy.
Yeah.
That statement that you just made, poor people don't have lobbyists.
Yeah.
Wow.
And we won't unite to try to get one. You know, even in our areas, you know, some of us are in the area. People are, as soon as you see somebody put together trying to pull some money together, we always think it's a scam. We so afraid of the unknown that it ain't gonna work.
So
instead of getting out there, and getting out. And if they do run off with the money, I mean, at least you tried.
Right.
So let's somebody talk about, like, what were some of the, remember when Obama came out with Obamacare, and from what I understand, it's nothing like what it was supposed to look like.
Right.
Why were people so opposed to universal health care? Like, seriously, why were
one of them was this fear of rationing, right? So when you think about socialist ideals, because that's what this really taps into, and Americans are generally apprehensive, even have a phobia of socialism, right? Or anything socialist related. So they're afraid that the government's going to start rationing the healthcare. And you can see some of the evidence, right? Even if you look at Medicare and Medicaid, right? You don't automatically get approved for treatment. You still got to go through a lot of red, yellow, green, blue, and white tape a lot of the time. So it's like, all right, hey, I need this surgery right here, and Medicaid could be like, no, we don't think you're gonna get that surgery. You reached your allotment or whatever, you know. So that's one aspect of it. But again, it seems more like a phobia, because even though that there's some evidence for it, there's no guarantee that that's how it will become, right? It's not. We just simply believe, or at least some of us simply believe, that the government, if given that authority, that power to fund our healthcare, that they would say no at anything. Hey man, I need this. I don't know. I got this amputated leg. I need a prosthetic. No, that's what we're afraid of. We're afraid that they're going to do that, right? So that's one of it. And that ties into public opinion. Public opinion shapes not only policy, but it also shapes the politicians who get in that space to even determine whether it's going to happen, whether it's going to be written down into a policy, whether it's going to. Bernie Sanders, man.
Oh my gosh.
Right.
Yeah, Bernie.
It's a simple solution to this, but they won't use it. All the money that we use towards the insurance, you know, we spend a lot of money on insurance. We spend a lot of money on healthcare and things like that. But they want to say, well, we'll have to raise taxes. Why would you have to do that when God level's paying $600 a month? I'm paying about $450 a month, and I'm just one person. Yeah.
Right.
So why would you have to do that? And this is what you collected.
Why is you having a heart attack over there, sweetie?
But literally,
She don't have to pay.
Yes.
She don't have
You
to. They don't
have
have to
to
by being
pay.
a veteran. That was one of the best things
Wait a
they probably
minute.
could have done.
Hold on, Aaron. Is that without? Is that just medical? Do we have?
Oh yeah,
eyes and
that's my medical.
have
That ain't
vision?
eyes and vision
And dental?
and
And dental?
dental. No, or life. That's just straight
that.
medical insurance.
It's just straight
I'm
medical. Yeah.
This
But
shit is
also you got to
nuts.
consider this, y'all, too. All right. So let's just say all the politicians came together and say, yeah, we're going to do this. Do you know how much restructuring you have to do for something like that? Because we're, as a nation, we're like behind. Like the other nations, they did this earlier.
Years ago.
So we're pretty heavily
Yeah.
populated. We got all these systems here, right? So
Mhm.
just think about it. Let's just start on the health insurance side, right?
Right.
You got all these different companies, and you're about to just say bang, 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 bang. That's a mass genocide of companies, privately owned. Okay, you just killed all those businesses. You just killed all those jobs, right? What you gonna do about that? Like you just told them, hey, no more private health insurance. Sorry, you guys. All the hard work you did to create this company from the ground up. Or do you say, all right, government, we just got to shift the budget. We got to buy all these health insurance companies, and you own them now. Like, do you understand? Like, that's the problem. It's a structuring problem. These are institutions that are in place. You can't just, all right, we voted on it and then wipe it away just like that. Like, it's the restructuring problem, and they don't know how to approach that. No one is.
Well, like what? How did other countries do it?
Ooh, I don't know.
Yeah, how did Germany do it?
Most of them, a lot of them, I think, before insurances came, did they ever have insurance? Before they had universal health care?
I mean, well, the UK, the what's the name model is based. No, the UK doesn't have universal health care. Canada is bigger than us.
Is free health care?
Yeah, they have universal health care.
Yeah, they have universal health,
and they just pay a
But
tax.
Did they ever have insurance?
Yeah, they just pay. Yeah,
they just pay a tax on it. That's it. And
Wait,
they have free health care.
Now I know.
Yeah.
I gotta Google it.
I know a lady. Well, when I worked in Florida, a lady came in. They do have insurance cards from Canada, and then they also she said it's free, but it's something has to do with their taxes at the end of the year.
Yep, they just pay a tax.
So it's added to the taxes, or I'm not sure, but it becomes a part of the taxes when they file taxes at the end of the year, or whenever their tax season is.
Do you know how, like, okay, so I don't know much about this, but the 1 year, the 1.5 year that I was on private insurance, right? I was like, you pay into like a marketplace. Is that what it's called? Like you pay into a marketplace like per month, do your job. and that's supposed to be like a supplement to your health insurance. Am I correct? Is it kind of like, I don't know, if you're listening out there and you know anything about this, about the healthcare marketplace system,
Please call us.
man, please, because
832-479-9035. I'm sorry. 832-479-9035. Because we don't know.
we don't.
We really do not know. Like, man.
Because I mean, that's like,
Oh, I'm reading this. It says universal life insurance, or is that life or health insurance?
Where are you? Are you on Google A too?
I am on Sir
Yep,
Google,
I'm
ma'am.
Googling.
I'm on Sir Google for real.
Everybody's on Sir Google A.
Yeah, because this is
Oh.
crazy. Oh my God.
The
Oh
general
yes,
tax
Tasha said, are
revenue
you
was
talking about an
federal transfers.
HSA? Yes, Tasha, I'm talking about an HSA. What is
Oh,
it,
yeah.
girl? Yes, what is
Oh,
that?
that's when they take
Health
money out of
savings
your
account.
check, so you can and give you like a credit card. It could be on a debit card, or it can be like they reimburse you. But HSA is something that you pay into, is really your money, but it's pre-taxed, and it's only can be used towards healthcare.
Okay.
So
Okay.
say for instance you put in $50 every 2 weeks, $100 a month, that's $1,200 a year. Some of them will put it all on the card at one time, and then you could use it at the beginning or at any particular time, and then some of them put it as you accumulate it. But it's all based, all specifically for healthcare.
Okay, so then what's the advantage? I'm like, that's like putting money in your savings. I mean,
Because
are you getting like a
it's
kickback
before
from?
taxes.
Ooh.
Because it's not taxed.
It's not
That's
taxed.
the only benefit. Mm-hmm.
The only benefit is it's not taxed. Wow. I'm really like, I'm at a loss because I'm looking at the Canadian healthcare system. They basically said that it's Medicare, but they provide that's how they provide social equity for all Canadians. Like they get a healthcare card. Let me see. Oh, and authorized refugees or protected people. You know, I can't. I'm
about to be a
Well,
refugee.
it still comes down to, it's just going to come down to budgeting, right? Like you really got to think, how is it possible for them to be able to do that, right? There's a cost, there's a demand, and then someone shelling out the money, right? So they're saying for all of our citizens, we're going to give you this card. All you got to do is just go to a spot, get your care, and that's it. That's all you got to do. They're going to send us the bill. We're going to pay it out, right? So there's policy. There's a consciousness that's
I bet you that keeps down cost.
Because the coding
that probably keeps down a lot of healthcare costs, because the government is telling them, hey, we ain't paying that ain't no $25,000 procedure. That's a $10,000 procedure, and this is what you're gonna get. So that probably does keep down a lot of costs, which makes it affordable for them to do that, because they don't have the insurance companies in the mix of everything. They saying this one flat fee, this is what we're gonna pay, and that's it.
And it's in their budget. By the way, it's in their budget. Like that's a key issue right there, because our country has problems budgeting. All that money we're making, and you can't allocate it to the right place. That's a budgeting issue. It's not, oh, the money ain't there. The money's there. It's just your priorities are stuff.
There you go. Say that.
You have more. You put more money. That
trickles down to the people.
You do.
Right. You got different companies lobbying different people up there in Washington to pass certain laws or whatever regarding their particular company. So yeah, you're gonna always have chaos, because those people up there are just worried about themselves and not the people. That's it. I got a chance to make $1 million with this company if I help pass this law. That's going to set me up for retirement.
Yeah, I figure that's a dance with the devil, being a lobbyist, because it don't make no difference what it is. Nuclear,
all I gotta do is just
ask
take
for nuclear waste to be poured in people's neighborhoods, and you can lobby for that.
Man, because somebody's trying to get a retirement, or they're trying to get, or they're trying to get constituents. They're trying to buy constituents You know what I'm saying? Like, oh, this district is gonna vote for. Oh my God, I can't. Like,
Yeah, that
It's
that had to be a
everything is about the
cutthroat whole
money.
game.
It's about the
yeah.
money now. We're just
Um,
oh,
peace, peace,
and here,
peace. Welcome, y'all.
peace,
Hey.
peace. Go ahead.
Listening.
I knew it.
I love all the great points. One thing we got to keep in mind: it's not about money. It's about credit. Ain't nobody paying nothing up front. Nothing.
Mm,
Exactly.
Nothing.
okay.
Nothing. You have to have people paying insurance so they can pay, quote unquote, the invoice when it finally comes. Insurance companies make their money up front. Period.
Mm-hmm.
Because you have businesses that come to the insurance company saying, I got 2,000 employees. Can you give me a discount? Yeah, we can. Give us 1.5. We got you. So what John was alluding to, he didn't go in depth. At some point, somebody got to pay the cost of all those deals, those contracts that's being done behind closed doors.
Mm-hmm.
So even with talking about coding, yeah, BandAid might be $25. It ain't just how much it costs to make that BandAid. It still got to get shipped.
Right.
How you getting it to the hospital? Who gonna actually put it on the hospital floor?
It goes through a lot of hands. You right.
How much it costs to actually come up with the system itself to even scan it in the computer? Who paying for the computer? Who paying for the scan? Somebody still got to eat this cost. Somebody. So yeah, it's big business, but until you understand how business operate, we on the first floor trying to see what they doing on the 16th. We ain't gonna never link up. It's too many floors in between us. We ain't gonna never link up. The conversation we having is not what they talking about. Because if at the end of the year, like John said, if they allotted 20 million and they had 19.7 and the CEO, he ain't get it. Hey, what's going on? Because last year it was 22. We'd have had this set up for 10 years. We losing money. This where coding come in at. Inventory.
Right.
Like you said, we can't go on them drawers and just steal. That's money just going out.
Out the door.
That's true.
So you mean this my business? I'm the owner. I got to eat this cost and pay payroll?
Mm. Yeah, man.
He bringing it from a different perspective.
Yes, he did.
Yeah.
I mean, it's
He's
the same
over here
perspective.
like-
This is still capitalism. It's still
Yeah, it's
capitalism.
100% capitalism. So you got, I mean, you know,
For
and then like with the,
For profit, man.
I'm here to make money. That's all I'm here to
Yeah.
do. I have,
This is the industry. Yeah.
look, think about it. If I had 100 million, what bank can I go to and say, look, no disrespect. I know we've been banking for 12 years. I'm just here to cash out 100 million. Do they got 100 million for me?
Hell no.
They're going to say, look, I tell
Good
you
luck.
what, you come back next week on Wednesday, we'll have you like 22 million and we're going to give you 122 in credit, which is a black card, so you can do whatever you want to. It's still it's gonna come right back down to credit. So we got to get somebody to funnel this money right back to the bank, just in case somebody asks for their 100 million, which they not, because we're gonna tell you, hey, check this out, sit down. I know about this beachfront property that, because we don't have what bank?
And all
What bank? Go to the bank right now. Anybody on this panel? Anybody listening? Go ask the bank when you go in there. Say, excuse me, can I cash out right now? My whole account plus my savings. You would think that you're trying to rob the place. Whoever that teller is gonna log out. She gonna lock up her drawer. She gonna walk to the back. They gonna come
That's
back up
true.
with a manager. Excuse me, sir. Why you? What seems? How you doing? First off, how's your day going? You okay? I'm sorry, Mr. Williams. Yeah, Mr. Williams. How you doing?
That is
What's?
true. Oh my God.
He been waiting all night for this. Baby, go ahead.
Right.
Go ahead.
Look, I'm not trying to spoil nothing. This is a great
No, you're
conversation to have.
not.
It's good dialogue, and it's very, 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 very important to educate our people and bring them up to speed. But if we ain't gonna really talk about what's going on, like John said, it's capitalism. It's not for profit. It's for profit.
Mm.
It's for profit. Period. Even if you're talking about budgeting, then that's where you got a problem. You want to lobby for real? Start budgeting. Start taking care of your community. Start taking care of your elders instead of putting them out. You want to lobby for
In
real?
nursing homes.
I'm just,
I just
you know,
said that. I just said that.
You're right. Start
just
at
saying.
home with your own lobbying.
Take your
hey,
people,
that's
take
my only argument. No matter
Yeah.
what topic we talk about, I'm always gonna say everything start at home when you finish with it. Everything start at home. If you got 10 people in a neighborhood of 100 and you got them 10 taking care of their home front, from the elder all the way down to the baby, that's gonna become infectious after a while. I don't know. That's my little spiel. It's all peace and love.
Definitely. It says, why should Americans care about their healthcare system?
What's that?
I mean, hell, we brought up a lot of the points
because,
here.
Our government
Yeah.
is broken. They have no reason to look out for us.
Yeah, I mean, Tasha said it. She said our government is broken. They have no reason to look out for us. And I honestly, Newborn just said probably one of the reasons why our government is not necessarily taking care of healthcare the way that they need to is because the U.S. has a budgeting issue. I mean, hell, look at how much money, how much credit we have taken from
Right.
China. You know
Other
what I'm saying? I
countries,
mean,
right.
so I mean, do
Yeah.
they really have the money to institute Obamacare the way that they were supposed to institute Obamacare? Do they really have the money to do universal health care the way that they did? You know what I'm
But
saying?
what about making for a great nation? Because it's like they don't even care about here. This is my thing. How we gonna fight a war if we all fat and fucked up and can't do nothing? Kids sitting in front, for real. The kids sitting in front of the video game. They ain't did nothing. They ain't got. Let 2 or 3 Chinese people come over here, and I'm not being racist. I'm being serious, and it sounds silly, but let 2 or 3 Chinese people. They gonna whoop the whole nation with their hands. Think about it. We ain't none of us. John probably the only one on this panel that's physically fit for hand-to-hand combat with about 3, 4 Chinese people. I'm being serious. Y'all laughing. Why aren't they taking care of us so we're healthy enough to handle our business? Because they can eat. They ain't got to drop a bomb. They drop one karate class and we fucked up.
I don't think it'll be
why are they
that
not taking
easy.
Go ahead.
But you do have a legitimate statement that you're making. But let's go as far as saying, all right. So let's say that do happen. What's the survival rate of those Chinamen in the hood?
Come on, man. Tasha said, "I got your back." Tasha's a vet too. Tasha said, "I got
They
your
probably
back."
gonna survive, right? They probably gonna survive because we too busy killing up each other. We ain't. Do you think we killing the Chinese man at the store?
We talking about where government ain't even gonna be in place. We talking about like we going at it.
That's
I don't even. Yeah, that it ain't okay. Shit. This is for entertainment purposes only.
I knew it was getting ready to pop up. I knew it was coming. Disclaimer.
The one thing that's feared in this world is a black man with a book first.
There you go.
Say that.
I'm gonna say first. Please understand what I just said. The one thing that's feared in this world is a black man with a book. Now, if you take that black man with a book and he's a thinker, then he becomes violent, and he knows how to control that violence, you can go get whatever race you want. It won't stand a chance. It won't stand a chance. You're going to lose. Period. You're going to lose. We make 2.9 billion? 2.9? What number is that? Now, that's only because of census. We ain't talking about the ones that, in the prison system, lost in the... I ain't going to talk about them. But just saying, just really think about that, though. So for whatever hood that you would talk about really policing or not even policing, and they have their own government the way they do stuff. I mean, you got some places right now, police ain't even allowed in.
I want to go back to that question. I'm sorry. Go ahead. My bad. Go ahead, boy. Go ahead.
No, I'm just saying. I'm not knocking what Miss Tanner's saying, but if you remove police for real, and violence is every day, it ain't gonna be just black on black. You're gonna see white on white. You're gonna see Japanese on Japanese. You're gonna see that in every area where there is poverty.
Yeah.
Now, who dominates? That's gonna come down to who's the most violent.
But let's take all of those different subsets, right, and apply that to why is it that the government is not taking care of the health care of its citizens, like with all of the different
That's easy to answer. They don't run themselves. Why we keep on thinking that everything tops out at the government? You think that's where it ends at? Whoever listen to this, whatever. Again, this is for entertainment purposes only. But you really think this stuff top out at the government?
Right.
Mm-mm.
That's it.
And that's the reason why it's for commerce. And that's the the government.
First of all, let's say you had that type of power. You trying to put your face on TV?
Right, and be seen on a regular basis.
Come on, man. Think about what we talking about here.
Press conferences, yeah.
You really go. First of all, what would your life be like being a multi-trillionaire? What's your life like?
Man, you going into hiding.
There's no who. Let's think of this first and foremost. Who's charging you? You are business. Literally.
Right.
Wherever you go. Let alone a government say something to you. You just had an ignorant Rockefeller almost 10 years ago on CNN talking crazy about killing people. Like, it's normal. That's what we do.
Billionaires love to be on the list and love to have their names put out there. Trillionaires pay them to not be put on the list. They don't want people to know who they are.
And you think the ones that are on the list are even legitimate?
Them the ones that's running everything. The ones you don't see.
The ones whose names that are out there, are they even legitimate? Or that's just a cap? They just out there saying, they just a face in a place for the moment.
They're just a placeholder. They're basically the face.
Mm-hmm.
They're just the faces. I mean, that sounds legitimate.
If I was able to create something, I would try to make sure my contract is good for at least 300 years. I'm just going to leave it right there.
At least 50. Isn't that the top amount of years that you can do like federal or state contracts for? Like if you've got like a railroad contract.
That's a basic
like
contract. I think he's talking about above and beyond. He's talking about the trillion. He's talking about the generational contracts.
When they make business deals.
Because when you got trillions of dollars, you got generational. You're not looking
money. At the next.
So you can say
years.
My trillion is going to be protected for the next 300 years.
4 generations. You looking at it like that? Like I need this to go all the way. Yeah.
Wow. Yeah, that's the stuff that we can't even fathom. 300 years. You know what I'm saying? That's the stuff that we can't even fathom. But in terms of, if you think about it in terms of healthcare, like that's the Rockefellers, that was one of the ways that they got rich. Was off of
that's what I was gonna say.
Man, one of the ways they got rich was they killed their partner that had money from a robbery. That's the origin.
This is for
entertainment purposes only. If you want, and his original name wasn't even. Never mind. Anyway, like I said, if I was able to create something, I'm doing a contract 300 years plus. I'm locking it all the way
Right, to
in.
protect your assets
All the way
forever.
in. And the only way you be able to avoid that contract is you dead my bloodline.
Mm, 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 mm.
And you can't afford to do that.
Well, you got billionaires coming up dead left and right. This is for entertainment purposes only.
Purposes only, yeah.
Oh,
Or missing. We don't even know what they got going on. They getting them and what they got in baby submarines. Were they billion or millions?
we was just
Listen,
talking about that the other day. I never seen the wives come on
You never
expressing,
seen nothing. You just seen the.
you
I don't even
know,
think you
the
seen nothing but that
sadness.
picture of them little in that little bitty thing, and then that was it.
Like who?
You ain't seen nothing. We didn't miss nothing because they didn't show us nothing. They just told us, and that was, and then right after that same day is when they told us about the lab grown meat.
Look,
wow.
check this out. Let me ask y'all a question. And I'm not trying to stray away from talk about the healthcare system. But if we are talking about the healthcare, all of
That's
it.
St. Louis accent.
Yeah. When you get to the top of that totem pole, what else do they own?
Hell, us.
I'm just saying, what else do they own?
They do
What if I'm just I'm just throwing something out there. What if you
everything.
found out Tyson's chicken had their hand in healthcare?
It
I
would
mean,
make
do you-
sense. Why? Because if we make you sick, we still gonna recoup on the back end.
Well, that's the reason why Rockefeller got into healthcare, petroleum, and chemicals, because of the fact that he was like, listen, we want to control ideas. We want to control the next generation of ideas that are coming out in everything. That's the people at the top of the totem pole. That's what
Well,
they.
you sound like you're
That's
talking
what they
about
are.
Google right now.
I mean,
Yeah.
no, that's part of it.
Yeah.
I mean, if you really think about it, if anybody wants to, if they really want like to make that real generational wealth, they control ideas in healthcare, ideas in digital and things that are digitally made. They control ideas at the top. They don't necessarily just own, oh, I just have this one patent for X, Y, and Z. They own the ideas. Those are the top people.
Mm.
Oh, the
You know
USDA
you
is
got
funded by a lobby. Oh, wow. We were just talking about lobbyists, Maryland. The USDA is funded by a lobbyist. And who are the lobbyists? You were just talking about lobbyists, Aaron. Just talking about that in healthcare and saying that that's the reason why we are, yeah,
right.
that's
Step back
crazy.
so far
Yeah.
because it's all about the money and who you can pay to go in there and play the ball, play the game.
Yep.
Mhm.
The way you want them to play it.
hmm
Yeah.
Wow.
Yep.
What you
We getting sold out for pennies.
we getting
So,
sold
but-
out? Are we volunteering?
Volunteering because you know what, they give us just enough to keep us under control, and I don't understand why certain people go for certain parties. But if you start looking at these handouts, everybody, because they give us so many handouts and they so good and they look out for you, why do y'all want all of this stuff from the government when they gonna regulate what you do with it? That's like being in a bad, and we in a dysfunctional relationship. I got a man taking care of me, paying my bills, but every time he give me the money, I got to bring him a receipt and show him everything that I bought with. Why are we doing this with our
Ooh.
government?
So why you still in a
And we-
relationship with him?
Ooh.
Right? Why are we not going to a different party
Why we gotta go to a different?
or creating our own party? But I would like to be at the lesser of two
Copy.
evils.
What I'm saying,
I'd
though,
rather
what?
be at the one that's not gonna hand out nothing to me.
Well, then that will require you to do some work.
What we got to do?
No, I'm not against you, Miss Tanner. I'm not against you at all.
I'm saying what we got to do. Let's
guess-
come on.
We are taught to be
Everybody else
happy
came up with
because-
ideas and made them work. I'm sure us as a group in the panel, we smart enough to make something happen. What can we do?
Got to
So-
start depending on ourselves.
So Maryland said that we are taught to be helpless, and the
Mhm.
government basically teaches us that
Mhm.
that this is the
There's
cure.
it's a cure. Yep.
Same house, beloved. You have to know how to get out of the house, not move to another room.
Woo!
That part.
There you go. I like
That's
that.
the
I
almond.
like
That
that
part.
too.
Chiming in. I don't know why he
Time,
just didn't sign in.
time you said beloved, I already knew that was the.
Ru-
Because let me tell you, beloved, it's the mentality. It's the. Sorry, I'm leaving. I'm leaving.
my God. Yes. His
Because
words
if you
come out
cover the
like
mentality of all the people who are at the top. Sorry, okay, I'm done. I'm leaving it alone.
Why
his
didn't you
words
log
come out
in?
like his words come out like silk, baby.
Oh my goodness. So true.
I
So
can
at this
share the
point, do we
video, get the
have
word out there.
any ideas on a resolution to this big healthcare problem?
Oh, we ain't even start to talk about the pay.
See
Ooh.
Right.
We ain't even the lack of compassion. They treat it like a business. The nurses treat it like a business.
what
We
if
have a
every time
Right.
you fill out an application before you fill out I'm gonna say after you fill out the application and you have your interview, you start treating it like a business at that particular point, right then and there. What if you started right there? Before you start signing your W-2s and all that, your I-9s and before you even move forward, you start treating it right then and there. That first interview, where you start treating it like a business right then and there.
So, what do you mean by treating? You mean treating your job as a nurse like a business?
I don't care what job it is. You treat it like a business initially, right then and there.
Hmm.
Because now we talking about the quality,
What's the
right?
likelihood of being hired, or what's the example?
Yeah.
Okay, let's take what you just said. What's the likelihood of being hired? You sound like a smart one. Because if I bring you in, guess what problem you gonna cause? You gonna cause other people to
I'm gonna be
think, well,
thinking.
dang man, exactly. I don't need you to think.
Mhm.
I have a position that need to be filled, which is a body.
I don't need thinkers.
It's
God
need a
forbid.
body.
I probably won't get the job. I was gonna say I probably won't get the job because I can't not think. I'm
So
always
so
gonna be
so
that person that asks that question. So I'm fired before I'm hired.
all right, now if I have 100 interviews and 90 of y'all saying the same thing, but I got a position, I got 20 positions I got to fill. Somebody got to give in.
Mm,
So who gonna give in? The business or the person that's applying for the job?
mm,
A person that's applying for the job.
'cause they need the money.
Because there
Because
we
you know
go
what they
again.
gonna
So
do?
Because
They're
they
gonna
need the money.
offer you an extra dollar or two.
they probably ain't gonna do that. They can probably lower it.
Mhm.
Inflation them up, man.
Come on, man.
Say that.
What we talking about here, man? What we talking about for real?
It's 138.
Oh yeah.
It's 138 on the Dow. We got all month to talk about this, to break it down. It's just a lot. It's massive.
It is. It is.
It is
But
very massive.
But I tell you, Aaron did bring up a solution, and I just want to go back to that because we were talking about how can you like leverage. So when you said that you can actually call the company of these, oh wait a second, okay, Marilyn said I am a nurse. I negotiated my pay benefits before my hire. Now we're at a freeze, overworked, and they are late. Oh wow,
Uh-huh.
Welcome, Lane. I'm with you. I'm right there with you.
I want to
It's,
say congratulations to her because that's where it starts. That part right there.
negotiating her pay and
That-
benefits.
Yeah.
Yeah, to the point where even though they doing layoffs, sooner or later they're gonna have to shut down. They ain't got no bodies to take care of nothing.
Yeah.
It ain't like the CEO finna come do the work themselves.
Not at all.
That's the point of having the position open. You have bus companies that shut down because of this.
Yeah, but then who does the work?
What you mean? You do the work. That's what I'm saying. Nobody on this panel is a business to the point we got 100 employees, 50 employees, 200 employees. We doing the work. We doing the work for somebody else's dream to be fulfilled, supplied. Until we start doing the work ourselves, putting in the work, willing to sacrifice, like what's she talking about? That's a huge sacrifice. All because she's doing it because of her moral compass. So it does come down to negotiation. She did the work to go to school to become a nurse. Who was there with her to hold her hand on that? So why she can't negotiate? She know her worth. She know her value. Companies say they don't want to pay, and that become infectious where you got other nurses, charge nurses, CMTs, everybody like, you know what, man, F this, I'm gone. Y'all don't want to pay me, I'm gone. Okay, you close that place down. Okay, all right, that's cool. Then you go to the next company. Yeah, it become infectious, and after a while, you either get with the program or you shut down.
Because at the end of the day, because of the fact that we are a capitalist nation, if you hit somebody's pockets, they're going to feel it.
Yes.
This is for
And if you do it
entertainment purposes
collectively-
only.
No, that's not entertainment. That's real.
No,
shit.
I know
hit
it is.
somebody's
That's why I
pocket.
said what I said. Yeah.
It's the reason. Like if you think about all the major movements that have actually made change by little people in America, it has all been because somebody has hit a corporation's pockets. Those are the ones that have worked.
It makes the loudest noise. It destroys the biggest nations. Violence is only used for protection. You can ride all day long, you ain't gonna change nothing. You just employed somebody else by destroying property. That's all you did. Somebody gonna pick that contract up. So I mean, I understand, the argument, the debate. Man, what you willing to sacrifice? You want to see some real change? What you willing to sacrifice? What old habit you willing to replace with a new habit, or a new thought process, or a new way just to move? Period. Like they say, whatever revolution that you thinking to start, it ain't gonna be televised. It never was.
Right.
By the time it hit them in the pocket, wait a minute, hold on. Why ain't nobody see this coming? What you mean? It wasn't talked about. We just did it. By the time an action takes place, it's already too late.
This is only for entertainment purposes.
But that was some real talk right there.
That was. That's true. Change is hard.
Prime example. What God level say? She said a real low and a real sweet God level voice. Just file exemption.
Thank you. Thank you. I actually made a TikTok about it. You wanna get their attention? Everybody march into HR
And file an exemption.
and file exempt for state and federal. You have to stop the flow of money. That's how you get their attention. This, oh no, I'm not gonna work today. I'm a nurse. I would feel some kind of way if I didn't go to work knowing that I take care of people who can't take care of themselves. This is a simple solution that everyone can take part in. When you stop the flow of money, you're gonna have everybody up there coming out of their offices like, okay, what's going on?
You know why though? I said it early. John keep pointing out. Hey, look, man, we ran off of credit.
Off of credit.
Yeah.
So what I'm trying to say is, if there's no cash flow staying in the account and instead of being withdrawn.
Yeah.
Oh wait a minute, hold on. Whoa.
Start cashing your checks out. Yeah.
No. I got a line of credit to take care of that. No. See, because every time the invoice hit, it's a zero balance. So the money that was paid into, we gotta start drawing from. Whoa, 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 whoa. What's happening now? I'm just being real, and that's from knowing trucking. All those trailers that you see moving on the highway, invoice, invoice, invoice. Ain't no cash being transferred. Ain't nobody paying out of Walmart. Ain't paid. Starbucks, Quick Trip. Ain't nobody paying no money. All invoice, contract, invoice. And when you send that invoice, what you got? 120 days to pay it? How many trailers can you move in 120 days before you pay the first bill? I'm just saying, it's all credit. That's why the entrepreneur that want to start up a business, if he ain't got no credit, he ain't gonna survive. It would take one breakdown, he out of the business. He out of business. It's the same thing with starting a private practice. The first thing they say, you got a surety bond? Just in case somebody do come after you, we got to cover that malpractice. What I need? Probably need about 10 million, just in case.
Minimum.
Hey man, look, the hole get deep. It depends on how you want to play with it. The hole get deep.
I don't even know how to close this out. This was just part one of healthcare. We're going to be doing healthcare all month for the next four shows. This was our first one. The last day of the month, we're actually doing current events, but this was just part one because healthcare is so massive. We're just scratching the surface right now. So, John, what you got for us this week?
I'm gonna try to do something short so we can yeah. I said going on a fast by slowing down. Like the Flash, without the backlash from Babylon, the slave masters' dream machine, breeding slaves, feeding slaves, but beliefs of freedom, but won't free the slaves. Keeping slaves working overtime to be mentally weak for days, steering them from the path they've traveled on with seductions from the math that babbles on. It says, don't let them multiply, divide the youth. Father, mother, sister, brother, yeah, divide them too, then divide by two until they're half nothing, feeling incomplete, always bragging that they have something. As they dream of being the minority, dreaming their colored skin is a deformity. Intoxicated, discombobulated, dominated, denominated, decimated, and confused, segregated, poisoned, incarcerated, subdued. The American dream is not American truth. Believing in the white hope is superstition. Believing in yourself, that's the true religion. The body is a temple. Starve it of impurities. No cheese, no meat, no insecurities. Less inflammation, more greens, more seeds, less acid, less sufferings, and many other things, right? Till my perception becomes the cleanest, unlock the clarity like an Xbox achievement. Check my ego like a pulse, but I need it without one. An egoless world where peace is the outcome and truth eventually will come out like loose teeth through rude speech. The devil and the ego is the lie. They both tend to hide like Jekyll, two sides inside one person, making two of one kind like Gemini. Whoa. We got to bring balance within ourselves. When justice is achieved, that's when justice prevails. So, got to bring justice to your temple. Detoxify, it's hard, but it's simple. Let meditation be your medication. Overdose in your elevation. The American dream is a hell of a drug. The powerless stay looking for the plug. So I unplugged from the machine. living solely off my solar energy. Purify the mind, purify the body. Purify the mind, purify the body, so you can be free. Salute.
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 Woo. John. This is why
One of the best
I'm
of it.
still having a what is it? Block, writer's block. I can't compete with that.
Yeah, you can. You have. You can write something throughout the week, but I know you've been busy. You've been busy.
Thank you. I appreciate that though. Oh my God. I don't even know how to end this. Do y'all have any last words?
See you next week.
Yeah.
Justice for Andre Rowland. I'll see y'all next week.
There you go. John, you got me?
I got us. Later, y'all.
Peace.